Hello, I would like to talk to you today about blood pressure. There's a misconception about the way blood pressure is diagnosed, or high blood pressure is diagnosed. When you go to a doctor's office, you notice most of the time, you'll go in and they'll bring you into an examining room and you'll sit there and immediately they'll put a cuff on you and start asking you questions and talking to you, never giving you a chance to relax, to rest, to get your blood pressure at a resting stage. So of course, the blood pressure readings will be higher than they should be. And because of that, they may misdiagnose that you have high blood pressure. It's more important that you just go in that room. They let you sit there for 4 or 5 minutes, relax, no talking, no questions. And then they take your blood pressure, not once, but 3 times within 10 minutes. And they can average the number of the 3, or they can take the last measurement as the one they would use to determine whether you have normal or high blood pressure. However, blood pressure is a very interesting subject when it comes to what is considered high blood pressure. According to the way the physiology works, the systolic or the high number is the one that shows the pumping action of the heart, the pressure by which the blood is pumped through the arteries. The diastolic pressure is the lower number, and that shows the resistance or the elasticity of the arteries in relation to the power of the blood flowing through the arteries. However, in order for the organs of the body to be able to function properly and get the proper nutrients, the blood pressure really is measured by a thing called the mean arterial pressure, MAP. That MAP is more meaningful than just the normal number of 120/80 or whatever. It needs to be taken to that level because the vital organs of the body, if they have a mean arterial pressure below 70, they will start to die. They will not get nourished properly, and they will start to fail. And if they have a mean arterial pressure over 110, then the pressure may be a little too high, which can cause aneurysms or bursting vessels or hemorrhagic strokes or things like that, which can cause a severe problem. So the mean arterial pressure is a maximum of 110 or a minimum of 70. This is the benchmark, what I call the gold standard of determining whether you have normal or high blood pressure. Now, what is the MAP? How is that calculated? Well, simply, when you take the correct, after averaging or relaxing, you take the proper systolic blood pressure reading, which is the higher number, and you take the lower diastolic number, the lower pressure reading, on the lower number, and you subtract the lower from the higher. The difference between the two is called the pulse pressure. And let's assume 120/80, you have 40 pulse pressure, 40 pulse difference. You take 1/3 of that number, which is roughly 12, 13, and you add that 13 or the lower number to the diastolic number of 80. And 13 and 80 is 93. It sits within the 70 and the 110 threshold. And if you do that with all of the calculations that they give you when they take your blood pressure, you may find that your blood pressure can go as high as 170 and be over 70 and still be within the 110 maximum of the threshold and still be considered normal blood pressure. As people age, the arteries in the body begin to stiffen, they get hard. Normal aging process will do that, and therefore the resistance or the diastolic number, the lower number, will become higher. And because of that, the body normally wants to compensate for that. So it increases the systolic pressure. Just imagine a water hose that's kind of constricted for debris in it, and you can't get much water coming out of the other side. Well, we turn up the power on the faucet to allow more water to go through or to push more water through, and you wind up getting the correct amount of water coming out the other end. Similarly, it works with the arteries. As the arteries start to harden, the systolic or the pumping action may increase to compensate to make sure that the MAP is correct within its normal boundaries so that the organs of the body get proper nourishment. So don't let the doctors tell you if you have something like 170 over 70 that you have high blood pressure. You may not. You may have to talk to them about MAP and let them explain to you why it's not correct. Thanks for watching.